My name is Mark Cresswell. I'm based at St. Paul's Hospital in Vancouver, which is part of the University of British Columbia academic complex. And I'd like to thank Bill for inviting me today. Today we'll be talking about brachial plexus imaging. As part of my disclosures, I thought it'd be appropriate to admit that I'm actually getting older, grayer, balder. So I put my picture up there as I've excluded the video image from the thing as it overlays some of the topographic pictures. The objectives of today's talk are to review the anatomy of the brachial plexus, become familiar with both the MRI and sonographic features of the brachial plexus, and understand where we may use one modality versus another. We're also going to become familiar with the common pathological issues around the brachial plexus, and I'm going to review from our hospital looking at the longitudinal use of MRI and ultrasound and what the relative advantages have been. The brachial plexus is comprised of 5 main roots. The C5 and 6 combine to form the upper trunk, the C7 nerve root is the middle trunk, and the C8 and T1 nerve roots form the lower trunk. There is some variability. This whole construct can move one level up or one level down, and we should be aware of that. These then form the divisions and the cords, which we see laterally and which pass deep to the clavicle. Once the nerve root exits the neuroforamen, it traverses between the anterior and posterior tubercles. The anterior scalene is attached to the anterior tubercle and the scalenus medius is attached to the posterior tubercle. The brachial plexus traverses between the two scalene muscles and at this point are forming trunks. If we look at the anatomical specimen, we can see the scalenus anterior, scalenus medius, and what we're going to be looking for is the nerves as they pass between these two, often encased in a little bit of perineural fat. In this anatomical specimen, you can see that we've colored in the scalenus anterior muscle belly, and immediately posterior to the scalenus anterior is the interscalene portion of the brachial plexus trunks, which form the divisions and then cords.